What are the various surgical options available for breast cancer? It depends on how extensive and how large the breast cancer is. If it's a large cancer, the only option available is mastectomy, which is removing the breast in its entirety. The other option, especially if the cancer is small, is to just remove the lump which is in the breast. It's otherwise called breast conservation surgery. So these are the two key words, phrases you need to know. One is called mastectomy, the other is called breast conservation surgery or lumpectomy. You can demand a mastectomy even if your breast mass or the cancer is small, especially if you have strong family history of breast cancer. But know that the least invasive cancer surgery is probably the best one. Also keep in mind that there is something called axillary disease. Every woman or men have lymph nodes in the underarm. That underarm portion is called axilla. So the commonest place where breast cancer travels after it has started in the breast is the underarm. So the surgeon, even if they do a breast conservation surgery or they do a mastectomy, they will have to test and see if the lymph nodes in the underarm, otherwise called axilla, have cancer or not. The surgeon uses two types of surgery for that. One is called an axillary lymph node dissection, in which case the surgeon would cut the axilla, the underarm, and remove a large bulk of lymph nodes and then send it for pathological evaluation. The other is called Sentinel Lymph Node Assessment. What it means is, if you imagine a warfare, there is a lot of soldiers in warfare. The commander would tell the soldier, one soldier, and say, hey, why don't you walk ahead, go ahead and see if the enemy is coming and come back and warn us. That soldier is called sentinel. So sentinel lymph node biopsy or assessment is where a surgeon just takes out 1 or 2 or 3 lymph nodes from under the axilla and tests whether there is any cancer in it. If there is cancer in it, sometimes the surgeon would then go for a much wider surgery. So these are the words that you need to know to understand what breast surgery means. Mastectomy, breast conservation surgery or otherwise called lumpectomy, axillary lymph node dissection or sometimes sentinel lymph node assessment. Know that surgery has advanced so much that the least invasive, the least problematic option is currently adopted as the best one. And the decision for which surgery should you undergo is usually done by a medical oncologist and a surgical colleague together in consultation. It's never a surgeon alone, because there are a lot of medical options that I use in my practice that can make the surgery easier if I give some treatment by mouth or through the IV before the surgery. So there are multiple options available. Be informed, know what kind of surgery you absolutely need, and get it done to cure your breast cancer.